University and completed his residency at the New York Cornell Hospital Medical Center. Keep our focus on this because this pandemic will not truly be over for anyone until we can vaccinate everyone that we can. And even when we are all safe from COVID-19, our work to recover will not be over. We have to rebuild our country stronger and fairer. And that work needs to start with building a stronger and fairer public health infrastructure. While over half of people now say they will get vaccinated, compared to around a third at the end of December.
The novel coronavirus has irreversibly altered our ability as the federal government to interact with innovators that bring real solutions to the greatest health care challenges in generations. Do not take this moment for granted. Strengthen the relationships and partnerships that have been established during this response. Take stock of the needs that still exist and how partnerships like these can help us all to address them.
This COVID-19 response team. Dr. Fauci, thank you for the work that you have done. And
less than 1 year, there was vaccines that had shown to be highly efficacious with a good safety profile. This is something that is unprecedented in the history of vaccinology and really is a reflection of not only the fundamental basic science advances, but extraordinary partnerships between the government and the private sector. Authorization from the FDA, including monoclonal antibodies from Lilly and Regeneron. There still are challenges ahead, particularly with regard to the variants that have now become very familiar to us. They are mutational changes in the virus strains that challenge us both from the standpoint of spreading more rapidly, having a greater degree of pathogenesis, and even evading some of our monoclonal antibodies.
For the prevention of COVID-19. I want to acknowledge.
But we can counter that in two ways. One, by vaccination, maintaining the immune response against wild type, either by continuing to get a good quarter of vaccinations or boosting potentially in the future. Also, and finally, as always, to continue to implement the public health measures in the forms of masks, distance, avoiding congregate settings, and washing hands.
For your invitation to talk with you today and for your leadership during the U.S. response to COVID-19. This is not our first emergency. Since 2009, the U.S. has faced 4 significant emerging infectious disease threats: the H1N1 influenza pandemic, Ebola, Zika, and now COVID-19. While urgency demanded rapid and unique approaches in response to each of these threats, none resulted in the necessary sustained investments for public health infrastructure. This lack of preparation continues to present significant challenges in our ongoing fight on COVID-19. If we don't act with permanent fixes, these challenges will continue to exist when the next public health threat emerges. As we monitor disease transmission and variants, we are getting vaccines into arms. First, CDC is leading with science and will continue to be the public health resource, scientific resource for the American public and for our international partners. Second, we are expanding the reach of life-saving vaccines and improving vaccine confidence. To end this pandemic, we must also maintain proven effective prevention measures: masks, hand hygiene, and physical distance. Third, health equity must be at the intersection of everything we do in public health, and I am committed to doing that as CDC director. And we must work towards sustainable investments in public health infrastructure to be better prepared for whatever comes next. Again, for the invitation to testify today, and I look forward to answering your questions.
Thank you, Dr.